السلام عليكم طلابنا طلاب المرحلة الخامسة. Our lecture today about dysmenorrhea and premenstrual syndrome. What we mean by dysmenorrhea? Dysmenorrhea refers to the symptom of painful menstruation. It can be divided into two broad categories: primary, occurring in the absence of pelvic pathology, and secondary, resulting from identifiable organic disease. Secondary dysmenorrhea may be a symptom of endometriosis, pelvic inflammatory disease, adenomyosis, Asherman syndrome, cervical stenosis rarely. Clinical feature of primary dysmenorrhea include the following. يعني عندنا primary dysmenorrhea و secondary dysmenorrhea. البرايمري dysmenorrhea الفيتشر اللي تيجي وياها onset shortly after menarche، يعني تجي بعد المنارك فترة قليلة، mostly less than 6 months, usual duration of 45 to 72 hours, often starting several hours before or just after the menstrual flow. Cramping or labor-like pain, constant lower abdominal pain, radiate to the back and thigh. Of unremarkable pelvic examination، يعني من أجي أفحص المريضة ما حألقى عندها أي شيء يجذب الانتباه أو أي شيء، أي فحص إيجابي يدل على something pathological cause, including rectal examination. The following may indicate secondary dysmenorrhea. هذه صفات الدysmenorrhea اللي هي secondary 1. Dysmenorrhea begin in the 20s or 30s after previous relatively painless cycle, heavy menstrual flow or irregular bleeding, pelvic abnormality with physical examination. احنا قلنا بالبرايمري ما راح نلقى any abnormality، بينما احنا ممكن نلقى pelvic abnormality. Poor response to non-steroidal anti-inflammatory drug, oral contraceptive pills. Infertility may be found. Dyspareunia, vaginal discharge. Also, it is a sign of secondary dysmenorrhea. Complete physical examination should be performed. Pelvic examination is crucial to exclude uterine irregularity, tenderness, nodularity. Diagnosis. No tests are specific to diagnose primary dysmenorrhea. The following may be performed to identify organic cause of secondary dysmenorrhea: endocervical swab, high vaginal swab, abdominal or transvaginal ultrasound, hysterosalpingography, CT scan, MRI, diagnostic laparoscopy, hysteroscopy, and diagnostic DNC. Management. Pharmacotherapy is the most reliable and effective treatment for relieving dysmenorrhea. Treatment of secondary dysmenorrhea involves correction of underlying organic cause. Non-steroidal anti-inflammatory drugs such as diclofenac, ibuprofen, mefenamic acid, oral combined pills, levonorgestrel intrauterine device, Dupot, medroxyprogesterone acetate, in addition to lifestyle modification, smoking cessation and exercise. Surgical treatment aimed at interrupting the nerve pathway from the uterus have been employed. يعني mainly هي pharmacological treatment such as non-steroidal anti-inflammatory drug, oral contraceptive pills, intrauterine device, hormonal type, Dupot medroxyprogesterone, lifestyle change, and finally surgical, which is rare option for management. What are about the premenstrual syndrome? Premenstrual syndrome, PMS, is a recurrent luteal phase condition characterized by physical, psychological, and behavioral changes of sufficient severity to result in deterioration of interpersonal relationship and normal activity. يعني لازم تجمع أولا هي recurrent تحدث باللوتيال phase، بيها أعراض physical, psychological and behavioral، كافية إلى أنه تسوي interruption للdaily activity of the female. Premenstrual dysphoric disorder is considered a severe form of PMS. Premenstrual dysmorphic disorder is listed as mental disorder. Pathophysiology and etiology. The definitive cause of PMS is unknown. Current research provides some evidence supporting the following etiology. Serotonin deficiency is postulated because patients who are most affected by premenstrual syndrome have difference in serotonin level. The symptom of PMS can respond to selective serotonin reuptake inhibitor, which increase the amount of circulating serotonin. Magnesium and calcium deficiency are postulated as nutritional cause of PMS. Study evaluates supplements show improve in physical and emotional symptoms. Women with PMS often have an exaggerated response to normal hormone changes, although their level of estrogen and progesterone similar to those in women without PMS. Rapid shift in level of this hormone promote pronounced emotional and physical response. Other theories under investigation include increased endorphin, alteration in the gamma aminobutyric acid, and hypoprolactinemia. To establish the diagnosis, instruct patient to chart symptoms daily for 2 cycles. This usually demonstrates symptoms clustering around the luteal phase of ovulation with resolution when mens begin. يعني هاي الصفات راح تتجمع باللوتيال فيس وتبدي شوي شوي تروح من بعد نزول المنس. Advise the patient to use a numeric score system to severity, 1 for mild, 2 for moderate, and 3 for severe form. When recording symptoms, ask the patient to bring her list to the next appointment. The categories of PMS symptom may be divided to 5 basic categories A, C, D, H, and O as follow. يعني عندنا 5 تقسيمات للأعراض ال PMS. ال A anxiety، يعني ال PMS ممكن واحدة من صفاتها تجي anxiety قلنا psychological symptom. وشون راح نعرف انه هالبيشنت عندها anxiety، عندها difficulty بالسليب، عندها tense feeling، irritability، clumsiness، mood swinging. هذا ال A. ال C craving such as headache, craving for sweet food, craving for salty food, craving for other type of food. Depression symptoms include the following: depression, angry, feeling for no reason, feeling that are easily upset, poor concentration or memory, feeling of low self-worth, violent feeling. H hydration. The patient may has weight gain, abdominal bloating, breast tenderness, swelling of extremities. And the last one is other symptoms such as dysmenorrhea, change in bowel habit, frequent urination, hot flush or cold sweat, general ache or pain, nausea, acne, allergic reaction, upper respiratory tract infection. Physical examination. Usually no physical findings are specifically helpful in establish the diagnosis of PMS. If the adolescent present during the luteal phase, she may have mastalgia or edema of the breast or legs. What about the treatment? For many women, lifestyle changes can help relieve PMS symptoms, but depend on the severity of the symptom. There is a rule for antidepressant treatment such as selective serotonin uptake inhibitor, which include fluoxetine, paroxetine, sertraline, and other, have been successful in reducing mood symptoms. And this selective serotonin reuptake inhibitor are the first-line treatment for severe PMS or PMDD. These drugs are generally taken daily, but for some women with PMS, use antidepressant may be limited to the 2 weeks before menstruation. يعني بس باللوتيال فيس نعطيها الانتيدبرسنت. Non-steroidal anti-inflammatory drug taken before or at the onset of the period. Non-steroidal anti-inflammatory drug such as ibuprofen, naproxen can ease cramping and breast discomfort. Diuretic spironolactone is a diuretic that can help ease some of the symptoms of PMS. Hormonal contraceptive, danazol, gonadotropin, releasing hormone agonist, stop ovulation, which may bring relief for PMS symptoms.